Namaste and a big hello from Team SLG Hello Doctor. We hope you and your dear ones are safe and healthy. A major cause of premature death, hypertension or elevated blood pressure is a common medical condition that significantly increases the risk of heart, brain, kidney and other diseases. According to a recent WHO study, worldwide about 1.28 billion adults between the ages of 30 and 79 years have hypertension. Close to half of them are unaware that they have it, and less than half of them seek treatment. Ultimately, only 21% of people have it under control. The global target is to reduce the prevalence of hypertension by 33% by end 2030. In this episode of SLG Hello Doctor, we will be talking to Dr. Bhanu Kiran Reddy, consultant cardiologist at SLG Hospitals, Hyderabad. He will help us understand how to recognize, tackle and live better with hypertension. Thank you for joining us, Doctor. Welcome to SLG Hello Doctor.
I'm glad to be here.
Doctor, the phrase "you're giving me blood pressure" has become common parlance now. So let's start with a very basic question. What is hypertension?
Hypertension is a form of cardiovascular disease wherein the pressure exerted by blood on the arterial vessels increases. It is measured in millimeters of mercury. It is measured with a sphygmomanometer, instrument used to measure the blood pressure. Normally, we define blood pressure when the blood pressure is more than 140 by 90 millimeters of mercury on at least 2 different occasions.
Doctor, what causes hypertension? Is it age? Is it genetics? Is it lack of exercise or emotional issues?
Hypertension can be divided into 2 types depending on the etiology. They are primary hypertension and secondary hypertension. Primary hypertension is a form of hypertension wherein no specific cause is there. Mostly this will be due to aging or maybe familial factors or genetic factors. But there are secondary forms of hypertension which can be due to any renal disease or thyroid disorders or adrenal gland disorders and other genetic disorders which are associated with salt handling capacity in the body. And as you asked, with age, for every 1 year, there is 0.6 millimeters of mercury increase in blood pressure for everyone. And if there is any lack of physical activity or indulgence of bad feeding habits like excessive consumption of salt, all this will add to increase of blood pressure more with age. So these are the important things which have an effect on onset of blood pressure.
Doctor, I know of a case in the family where ignorance at first and then ignoring to take medicines led to the premature exit of a very good family friend. He was a very fine gentleman. So tell us, what are the warning signs that we need to look out for?
Hypertension is a disease which is not characterized by any specific symptoms. Most of the times in hypertension, it is diagnosed when we monitor blood pressure casually, or in most of them, the hypertension is diagnosed when they have some end organ damage, like they may present at a hospital with a heart attack or brain stroke or any renal problem. Then only they will find out that they have hypertension. Some patients may have headache or blurring of vision or giddiness or chest tightness, difficulty in breathing. These are all signs of hypertension because excessive pressure in the blood vessels will be exerted on the heart, which will lead to difficulty in breathing and all other symptoms. But at particular, there are no specific symptom which is significant for hypertension.
Doctor, does hypertension set in stages, or is it just once for all it is there?
So there are staging of hypertension, but it is not that everyone will pass from one stage to another. At the time of diagnosis itself, patient can be in any of the stage. To say in particular, optimal blood pressure is less than 120 by 80. Suboptimal will be 120 to 129 by 80 to 85. Pre-hypertension, it is 130 to 139 by 85 to 89. And stage 1 hypertension is 140 to 159 by 80 by 90 to 100. Whereas stage 2 hypertension is 160 to 179 by 100 to 109. And stage 3 is more than 180 by more than 110. It is not that every patient will start from stage 1, then they go to stage 2 or stage 3. Any patient can even be diagnosed in stage 3. This staging is especially used to start the treatment. Especially patients in stage 1 Depending on the risk factors, we can either directly start medical treatment or we can start any lifestyle modification followed by medical treatment. But any patient, if they present directly in stage 2 or stage 3, irrespective of the risk factors, it's always ideal to start medical treatment.
What is the treatment for high blood pressure, and can it be cured at all, completely that is?
Blood pressure is a disease which has very good treatment options. Initially, as I already discussed, in stage 1, we can try lifestyle modification, which mainly includes reduction of weight, food modification by including excessive of uncooked food, maybe fresh fruits, vegetables, dry fruits, legumes, avoiding excessive salt, increasing the potassium intake, then going for regular physical activity, which mainly includes cardiac activity like jogging, walking, swimming or cycling at least for 30 minutes per day for at least 5 to 7 days per week. It is not that hypertension is rarely completely curable. Like if we are taking our treatment regularly, it can be kept under control and we can prevent the side effects due to hypertension, which mainly includes heart attack, heart failure, then CVA, that is brain stroke, and kidney dysfunction, and retinopathy, hypertensive retinopathy, which can lead to blindness. By keeping in our hypertension in control, we can delay or completely avoid these complications of hypertension.
So doctor, what is the quality of life once we contract hypertension?
Hypertension doesn't affect any quality of life if we are able to use our treatment regularly and prevent from the end organ damage, which is the most significant complication caused by hypertension. Especially if we ignore our medication, every person with hypertension is prone to develop paralysis, brain stroke, which may be hemorrhagic stroke or ischemic stroke, that is due to leakage of blood into the brain or formation of the clots, or they may present with heart attack, which may be associated with cardiac dysfunction, which is known as heart failure. So if we are able to use our treatment, there are many randomized control trials which proved that by keeping our blood pressure within the normal range, that is less than 140 by 80, we can avoid the complications of hypertension to large extent. And there are several trials which proved that by controlling the blood pressure, the all-cause mortality might be reduced by 20%, the stroke risk is reduced by 35%, coronary artery disease risk is reduced by 20%. So just by taking medication, we can have a normal quality of life without affecting any of our regular activities.
Let's take a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. Doctor, what is the kind of diet one needs to follow to keep blood pressure in check and also to prevent blood pressure?
Hypertension is a disease which is known to be associated with the sodium intake. So primary concept in controlling the blood pressure would be reduce our salt intake to less than 3 grams per day and increase the potassium intake, because potassium is known to decrease the blood pressure. There are studies which showed that just by reducing the salt intake, blood pressure can be got down by 5 millimeters in the systolic and 3 millimeters in the diastolic. Blood pressure reduction can be brought. Apart from that, by taking fresh fruits, vegetables, legumes, nuts, all this inclusion in the diet and taking of saturated fats will also help us in controlling our blood pressure.
Doctor, we see that alcohol and smoking are bad anyway. Do they have a direct effect on hypertension?
The nicotine present in the smoke is known to cause vasoconstriction, and this is one of the most important risk factor for increasing incidence of hypertension in the young population, because nicotine causes vasoconstriction, which is momentary initially, but as smoking is a chronic habit, this vasoconstriction becomes permanent and will lead to hypertension. And with alcohol binge drinking is known to be associated with hypertension. So there can be moderation of alcohol to less than 2 drinks per day for men and less than 1 drink per day for females, which can avoid onset of hypertension at young age.
Doctor, we've heard of cases where women develop hypertension during pregnancy. So what happens in those cases?
So pregnancy-induced hypertension itself is a very critical disease in few, because it might be associated with onset of seizures, and it can lead to complications to both mother and child during birth and before birth, and after birth of the child also. Mother can be at increased risk of stroke and death due to pregnancy-induced hypertension. So most of the cases with pregnancy-induced hypertension is an indication that the mother has more chances of developing hypertension in the future. So all the patients who had pregnancy-induced hypertension should be under regular follow-up to see for early onset hypertension in them.
Doctor, is there something like pediatric hypertension? Do children contract hypertension at all?
Children also can get hypertension at any age, but for children there are no values like 140/90 or anything. They have age-related hypertension charts. Depending on them, the hypertension in children can be diagnosed. In children, it will be mostly due to any vascular disease or any secondary causes like endocrine diseases, mainly thyroid or adrenal gland related disease, or genetic diseases like Liddle syndrome and other channelopathies which are associated with salt handling from the kidney. So in children also, if there is any signs of vision problems or anything, their hypertension should be checked and they can be treated normally with the drugs like adults.
Doctor, you really helped us understand the nitty-gritties of hypertension. Do you want to leave our audience with some parting advice?
As I already told, hypertension is a disease which is not associated with any specific symptom, and it can be diagnosed only when we can check our blood pressure regularly. Maybe at least every 6 months, everyone who has crossed 30 years should check their blood pressure, because it is a disease which can be diagnosed in most of them when they have some end organ damage. To prevent that end organ damage, they can get it checked every 6 months. If there is any abnormality in the blood pressure, if they check at home, they can consult a physician or a cardiologist to get an opinion regarding any medical advice or dietary modification to be done to control their blood pressure.
That was a wonderful piece of parting advice, Doctor. Thank you so much for joining
Thank
us
you.
on SLG Hello Doctor. We will be back with you in 2 weeks from now with yet another healthcare expert. See you back here, happy and healthy. Viewers, don't forget to hit the bell icon to keep track of all that's happening at SLG Hello Doctor.